Hey everyone, so today we will be doing the application of Perilight procedure. So what are the objectives for this? First, to reduce swelling by increasing circulation on the episiotomy site. Second, to promote healing by increasing oxygenation of tissues. And lastly, to prevent suppuration in cases of infection. And what are the materials or equipment? First is the heat lamp or Perilight. Second, tap sheet. Third, underpad. Fourth, medication or administration record. Now, let's proceed to the procedure steps. But before that, we have to discuss first what are the assessment. First, assess episiotomy site for swelling, redness, excoriation, and presence of odor. Second is assess episiotomy site for discharges, including the color, amount, and odor. And for the planning, at the end of this procedure, the client will be comfortable and the client's episiotomy site is free from any signs and symptoms of infection. And before anything else, we have to provide privacy for our client. And after that, before we proceed to all the procedures, we have to perform hand hygiene and wear our gloves. And after that, we have to check the doctor's order, and the order must include frequency and duration of application. And it is stated here that the prescribed time is for about 15 to 20 minutes only. And after that, we have to obtain the Perilight and check for proper functioning and condition of the equipment. And we also have to use a 40 watts bulb only. Now that we're done, we have to introduce ourselves.
I'm your student nurse for today from Medici de Makati College. So I am here to do the Perilight procedure in order for you to reduce the swelling of your wound and to increase the circulation on the episiotomy side. And I would also promote the healing by increasing the oxygenation to your tissues and of course to prevent any cases of infection. So may I just verify your identity, ma'am? So can you state to me your full name and date of birth? Rose Ann Manalo. And when was your birthday? July 21, 2004. Okay, ma'am. May I just ask for your cooperation with the procedure that we will be taking, okay? So, ma'am, I would explain to you the procedures that we will do. So, I will be putting this Perilight for about 15 to 20 minutes, but every 5 minutes, I will ask you if you feel any different sensations like numbness and any kind of skin maceration and discomfort.
Now, we have to take the vital signs for baseline information, and if there's any abnormalities, we have to refer it immediately.
So we're done taking your vital signs. And earlier, we've done the perineal care, so we will not do it anymore. And now I'm going to prepare the Perilight at the bedside. And I've already done doing the hand infection control. So now I'm going to position you in a dorsal recumbent position. And I want you to cooperate with me. And I'm going to put also an underpad and do a diamond drape for you to be in an easier, for me to have an easier way on performing this Perilight procedure now, okay?
And once we assist the patient in dorsal recumbent position, we must put the underpad underneath her buttocks and perform diamond draping to the client, exposing the perineum. And after we do the diamond draping, we have to position the Perilight at least 18 inches away from the perineum, and with the Perilight in place, drape accordingly. And you also have to instruct your patient to prevent unnecessary movements. And you also have to stay with your patient all throughout the procedure. And every 5 minutes, you must ask your patient if she is feeling any numbness or any sensation. And once done, after the prescribed duration of treatment, remove the heat lamp, loosen the diamond draping, and cover the patient with the top sheet. Place the patient in a comfortable position and do the aftercare. And yes, we're done. Now we have to discard the PPE appropriately and perform hand hygiene. To sum it up, for the application of Perilight procedure, there will be no reporting of significant findings since there is no swelling, redness, excoriation, presence of odor, discharges in the episiotomy site. And for the documentation and recording of the findings, I've already made it in the chart using appropriate terminologies. And for the evaluation, the patient's response for the treatment and patient's comfort is highly recommended, and there is no signs and symptoms of undesirable responses to treatment.